Welcome back to another edition of my Ask Me Anything. There's a lot of your questions today, a lot of new ones that I don't usually answer, so we'll get to it. So let's see what the first one is. First question up tonight is, what would I do if I were diagnosed with microvascular disease? I would work on improving my nitric oxide levels by being outside in the UVA sunlight. I would exercise every single day to stimulate the glycocalyx being stimulated by the blood flow and cause the endothelium to release nitric oxide. I would eat green leafy vegetables. I would take different nitric oxide promoting supplements and likely a glycocalyx promoter. I may or may not take N-acetylcysteine to support glutathione stores. If your blood pressure is elevated, greater than 120/80, potentially an ACE inhibitor, angiotensin receptor blocker, that would be to start if I had microvascular disease, and then do a comprehensive blood work panel to figure out why you have microvascular disease. Lots of good questions tonight, so I'm going to keep powering through them. So what I think about or know about NMN, it's a supplement that is reported to increase NAD levels in the mitochondria. It's never been proven that it actually gets in the mitochondria and actually does increase those levels. There is not a blood test that you can test to see do your levels actually increase with the supplement. So if patients are interested in taking the supplement, I tell them that they're going to have to be their own kind of guinea pig, because they're going to have to know that when they take the supplement that something improved after taking it, such as exercise tolerance is better, or brain power is better when you're doing deep thinking, but there's no lab test you'll be able to point to that the NMN is actually working for you. So for most people, I do not recommend it. It's not likely harmful, but if you're going to take an appropriate dose, which is usually at least 1 gram a day, you're going to spend well over $100 a month to get that dose. Question up. Are there any studies on varicoceles and how it impacts testosterone levels? I'm not familiar with the studies per se, but definitely varicoceles can lower testosterone levels because the increased blood flow supply from the varicoceles can affect gonad production of testosterone. So not an uncommon finding that if people's varicoceles get treated, their testosterone levels would improve. But I don't know the studies because that's not necessarily my area of expertise. Question, is there real concern for people with earlobe creases and heart disease? The answer is yes, but it's not a one-to-one correlation. So there's a physical finding called the Frank sign when you have a diagonal earlobe crease, that may be due to issues with collagen, and that is associated with increased risk of coronary atherosclerosis. So it's associated, it is not necessarily causative. I always examine my patients, and if I see it, I always bring it up. But I'm also doing testing that looks at their microvascular system, looking at the actual arteries, with ultrasounds or CT scans. So it's associated, but does not mean that you're necessarily high risk. But go get checked out. Question, can soft plaque be detected on an echo? If you're thinking of an echocardiogram, then no, you're not going to see the coronary arteries on an echocardiogram. In an adult and children, sometimes you will assess the coronaries with echo, but for soft plaque, you can assess it with CT technology, or soft plaque you may see with an ultrasound if you're doing it on the carotid arteries on the side of the neck, or the femoral arteries in the arteries going down to the leg. Person's commenting that they've had atrial flutter for 10 hours straight, premature atrial beats daily, and it's a new issue. Sounds like you need a doctor's appointment to figure it out. Oxidative stress inflammation may be high, driving the atrial flutter. There's other things that may be driving it, thyroid, being overactive, electrolyte imbalances, untreated sleep apnea if you have snoring. So it needs a workup to figure out what's causing the atrial flutter. Atrial flutter is sometimes more resilient to not popping out without medications or a cardioversion. So some patients will ultimately like to have atrial atrial flutter ablations, which are generally more curative than doing an atrial fibrillation ablation. Why does high blood pressure increase cardiovascular risk? High blood pressure is the #1 risk factor for increase in cardiovascular risk because it damages, via shear stress, the endothelial glycocalyx. The endothelial glycocalyx is the protective gel coat lining your 60,000 miles of blood vessels. Think of your glycocalyx is, a Teflon surface, or if you took a fish out of water and it's slimy, that's the consistency of the endothelial glycocalyx. High blood pressure is going to damage that coating, which then will lead to lower nitric oxide production from the underlying endothelium. When you have lower nitric oxide, then the cholesterol particles, the lipoproteins, and the white blood cells will more likely stick to the artery lining and get retained in the artery wall and kick off the cascade that leads to plaque formation. So that's why you want to monitor your blood pressure and treat it if it persistently stays greater than 120/80. Despite lifestyle interventions. Question, do I have any thoughts about hydrogen water? Is it hype or is it real? It's not necessarily hype, but the challenge is getting high quality sources of it and not being exposed to high levels of deuterium in the process. There's no way that you're going to be able to test if you have high levels of deuterium in the water. If you're getting magnesium tablets and dropping them in water and it's making hydrogen gas, well, you don't know the quality of the magnesium tablet. There are the electrolysis machines. I think there's a question later asking about the Kangen water. The main way it probably works is that it's creating hydrogen water. Hydrogen water, is a antioxidant for decreasing oxidative stress. So that's probably how it works. A lot of the research has been done in Japan. Sometimes when I travel, I will drink, hydrogen water on the planes, but it's not a routine part of my stacks. So I don't know exactly what the person is wanting me to try to answer on this part, but I'll do my best. So how do the gut, brain, and heart work together? What can we do to improve on it? They're all connected with the vagus nerve, so you can do things that improve vagal tone, such as meditation, heart math, biofeedback, the Apollo Neuro device. There's vagal nerve stimulators. That's what you would do to kind of, get them all working together. So. Question, can I discuss heart rate variability and how to measure and how to improve it? So heart rate variability is the beat-to-beat difference measured in milliseconds between the R waves on an EKG. That's the technical way to say it. But if your heart rate is the beats per minute, the heart rate variability is the difference of the beats measured in milliseconds between the following beat. You can only measure it with a electrocardiogram, EKG. You cannot put your pulse on your neck or your wrist and actually measure heart rate variability. You have to have an electrical tracing to be able to measure it. The best way to measure it is with a chest strap. So there's different brands that make them. Polar makes a good one. No affiliation with them. That's how I started. I had a Polar H7. I think they're up to the Polar H10 now. I personally use the Frontier X2 strap to measure heart rate variability when I'm working out. And then another app that's useful for it is the Elite HRV. It works with a lot of the trackers. Sometimes the wrist-based ones and the ring ones can pick it up, but they're not truly measuring heart rate variability. They're measuring pulse wave velocity variability and inferring what the heart rate variability would be. So how to improve it? Well, try to figure out what's driving it low, if it's off your normal baseline. There's a lot of people with, quote, low HRV, and if they actually do the chest strap, they don't have low HRV. Are you overtraining? Are you not sleeping well enough? Are you getting sick? Those are some of the big things that tend to drive downward pressure on HRV. But first get a proper device, ideally a chest strap, and get either the Elite HRV app or use something that comes with the Frontier X2 if you end up going down that route. Question, do I think colchicine has the promise for primary prevention? I think it has the promise, but the side effect profile is not benign with a lot of GI side effects. There's a recent trial. using a lower dose called low-dose colchicine, 0.5 milligrams daily, in patients with vascular disease. It was secondary prevention. It is going to help lower uric acid, which drives oxidative stress on the endothelial glycocalyx. So that's probably the mechanism of action, how it's working in those patients. So possible primary prevention use. I check uric acid on every single patient, every single time, generally with their levels under 6, and use whatever lifestyle interventions I can to get it down. And then, either colchicine or allopurinol to drive down if it needs to go to pharmaceutical treatments. Question, just got labs, total cholesterol 249, trigs 53, HDL 82, LDL 159. ApoB 117, what should I do first? This is not being flippant, but talk to your doctor who ordered the test. Why did you actually check it in the first place? If your ApoB is 117, you're going to be near the 80th percentile or higher, meaning 80% of people have levels lower than that. Triglycerides being under 80 argues against insulin resistance as being the cause, but the trig HDL ratio is not the be-all end-all of evaluating metabolic health. And I'd want to know, what is the health of your arteries? Because that's really what you're asking. Is high ApoB actually damaging your arteries or contributing to plaque formation? So depending on your age and if you've had previous events, you may want to consider doing a CT coronary calcium scan or a CT coronary angiogram to figure out do you have plaque in your arteries, and that will tell you how aggressively to treat ApoB with either medications, lifestyle interventions, or supplements, or a combination of all three. Could a hiatal hernia cause PVCs? I guess theoretically I've not seen it. I guess there could be some actual mechanical disruption of the left ventricle with the hernia, and maybe the ventricle would be irritated. I've not seen it, but you would have to potentially wear a monitor and figure out how many PVCs you're having, and also have a workup including that your left ventricular function is normal in an echo, that you don't have hyperthyroidism or electrolyte imbalances. So PVCs are not usually a problem for many people unless they're symptomatic, especially if they're like passing out or having chest pain with them. But hiatal hernia causing PVCs, I've not seen it. I guess it's theoretically possible. Question, my blood pressure has been at or below target for a month, but then for the last days it shot up. So you're going to have to do the kind of Sherlock Holmes, what changed in your environment? Because I often talk with patients that blood pressure is not necessarily a disease, it's a response to your environment. Sometimes it's lower nitric oxide availability. So maybe you've changed your nutrition patterns, maybe you haven't been outside in the sun, maybe you haven't exercised, maybe you're getting sick. Don't know exactly why it's driving up, but there's some type of variable that changed that caused your blood pressure to increase, and that's what you got to figure it out. Question, what is my thoughts on pre-workout supplements? Most of them contain a pump and nitric oxide in them. I'm definitely not an expert in all the pre-workout supplements. Some of them are probably benign. Some of them can be harmful. Basically they have a lot too much caffeine for people who are slower metabolizers of them. So, you'd have to work with somebody who knows what they're doing when they're recommending a pre-workout supplement. For the most part, the nitric oxide boosters, they're all just pumping a lot of arginine in them. If you're younger, it's probably not going to be harmful, but when you're older, you lack the ability of the endothelial nitric oxide synthase enzyme, eNOS, to be able to convert that arginine into citrulline and give you nitric oxide. So more likely it's just a waste and you're not actually getting a benefit out of it. So nitric oxide is definitely beneficial if you have the right products that actually create the nitric oxide gas that dilates the microcirculation and brings blood flow to the tissues. That would potentially help your exercise if you had more nitric oxide before that. So, so there are different products that are more geared towards people with vascular disease that would be probably an excellent pre-workout supplement. But the other ones that have just a ton of caffeine in them, you got to be careful with them especially if you're a slow metabolizer of caffeine. All right, this is a good one. I have answered it in the past, but I'll answer for the audience that hasn't heard before. Somebody was asking, what was my experience with the Pernuvo scan? So the Pernuvo scan is a head-to-toe MRI scan, looking for aneurysms. It's looking for cancers at the earliest stages, likely well before you have any symptoms. Available at the scanning centers in most major cities. There's not currently one in St. Louis where I'm located. So I went to the Dallas location, had a pleasant experience there, very straightforward. I booked it online, showed up, it's kind of like a spa type of facility. Check in, you're fasting, they give you like a bottle of water, and then you change into a pair of scrubs. And then within about 10 minutes, they had you on the scanner. You do kind of get locked into the scanner where, you have some things that are restricting your head and your body from moving so that there's no motion artifact, but I did not necessarily feel that claustrophobic in it. And then there's a mirror that they project over your eyes. So looking straight up, you're able to watch TV. So they were projecting Netflix in there. So watch the Netflix show for about an hour and 15 minutes or so. The tech walks you through it the entire time. There's some breath holds that you have to do for 10-15 seconds sometimes, and the tech will warn you like, okay, now it's going to kind of get loud, you're going to hear the magnet spinning. You do have some ear protection on, and you also have the headset on so you can hear the Netflix that you're watching. But after about an hour and 15 minutes, they get you off the table, you change back into your clothes. There's a snack bar that you can kind of power up on. Then you check out. It takes a minute or two to check out, and they tell you that you'll usually be having the results pop up in your portal within a week. So I think it was 48 hours that I had the full report, and then you have the ability to talk to one of their nurse practitioners to go through the results and ask any questions. So I did sign myself up for that, even though I didn't necessarily need a medical consultation or what it was. Fortunately, I didn't have anything that was too crazy. I really wasn't personally concerned about any cancer for myself, but wanted to make sure I did not have like a barium aneurysm in my head, which can't feel until those things rupture, and they're often fatal when they rupture. So trying to find the kind of the low-hanging fruit of things that take you out early. So I had a very good experience with them. I do recommend it to patients if they're interested in getting screened for cancers. I did pair mine with the Gallery test, the liquid DNA biopsy, because the scan doesn't see everything, and the liquid biopsies don't don't assess everything. So I felt a little bit more confident having a liquid biopsy and an MRI that things were truly low risk at this time. And then at some point in the future, I would repeat the scan, but probably no sooner than 2 to 3 years after my baseline scan. This ties into the previous question about hydrogen water. So what are my thoughts on easy water? This is also known as structured water. If you're wanting a good book about easy water, Gerald Pollack has a book called The Fourth Phase of Water. Explains what it all is, but it's structured water. It's not like the water that's in the glass that you drink from. It's more like a gel water. And the endothelioglycocalyx has a lot of easy water in it. So that's why a lot of the supplements that stabilize the glycocalyx is working through structuring the water in the glycocalyx. Kangen water, I've tasted before. I've seen one of the machines. I don't remember exactly all the science behind it, but I think it's probably more that it's making hydrogen water than it's truly making the water structured, because it's really more the water once it's in your body, and it's the mitochondria's water that you're structuring, not so much the water that you're drinking. You just want to have things in your water that collapse your own structured water. So that's why you want to avoid fluoride. You want to avoid the microplastics that are in water, heavy metals. So filter your water, drink spring water, drink glacier water. That way you don't damage your own easy water inside. But if you want to drink Kangen because you like it, fine. But the claims of it being better because it's higher in pH, that's not really that scientific. So that's my opinion on the Kangen water. Opinion only. And this is one that I don't know the answer to, so I'm going to have to look it up. So thanks for asking this one. Somebody's asking about the relationship between nitric oxide and GLP-1 activation. So I don't know if there's a link. There may be. So let me do some research, and I'll get back to you guys on that one. So I saw a few things popping up in the comment sections. I think one of them answered. I think it was asking about the colchicine. See a lot of familiar faces in the audience. Some of my patients, some are family members. Some are probably some future patients. We have patients literally from all over the United States. Actually some international patients as well, stopping by at Apollo Cardiology to get their vascular system screened out. And a lot of those names are familiar in here. But if I talk to you just through Instagram and you see me in the office, I don't always remember what your handles are. So remind me if I've ever spoken to you on Instagram before. All right, so somebody's saying no dye. I assume that means for the question for the Prenuvo. Yes, it's a contrast-free study. All right, so I got you through all the questions. There seemed to be more than usual, which is awesome. Glad I was able to get through them in about 20 minutes. Tomorrow I'll post in my story. I'm going to do one of the Empower DX scans at home. This is a home test where you can test your cholesterol balance test. I get this question a lot. If you don't have access to the Boston Heart Lab panel through your doctor, how can you check to see if you're a hyperproducer or hyperabsorber of sterols? Well, this is the test. There's a tube. You have to use a lancet that's bigger than the usual glucose finger sticks. So you get these big drops of blood, and then you fill this thing up. You put it on an ice pack, and then you ship it out via FedEx. The secret is they actually ship it to the Boston Heart Lab company, and they're the ones that run it, and it comes on the same report as I usually see for my patients from Apollo Cardiology. I did do this earlier in January, but they reported that there wasn't enough blood in there. I don't know exactly how it's possible because I felt like I was bleeding like a stuck pig when I did this one, but I'm going to redo it and see if I can get the results back. I think reportedly the results come back within 7-ish to 10 days, and so I'll know if the kind of lifestyle interventions I've been doing in the past few months and if my supplements are keeping my lipoproteins where I want them to be. So I'll let you know how that goes tomorrow. So let's see. Well, you're very welcome. Thank you guys for the kind words. Yes, great AMA. Awesome. Thank you. Yeah, I always appreciate the feedback. The questions have been great. This helps, not only my patients who followed this, it helps a lot of patients who may not actually have access to coming to see me in St. Louis. So that is the only way currently patients can work with us, is that the first visit will be live in St. Louis. That way you have access to all our non-invasive vascular testing. We can tell you how healthy your endothelium is. We can start looking at, do you have soft plaque in your carotid arteries? Do you have elevated blood pressure in your legs? Do you have an aneurysm in your aorta? We have all the devices to be able to do that in the office. If you're of the right age, and haven't had one, we would help get you set up to do a CT coronary calcium scan or potentially a CT coronary angiogram. And then we often will pair it with the Clearly AI algorithm to look at the total plaque volume in your artery walls. The Clearly scan really quantifies if you're high risk or low risk based off the types of plaques that are building up in your artery walls. And then we draw the Boston Heart Lab panel or Cleveland Heart Lab panel, and then whatever genetic testing is necessary. Generally takes about 2 to 3 weeks for all those results to come back. And when the results come back, then we set up an hour-long Zoom call to review the results. That's usually what I do on Mondays, so I was doing that with some patients from all over the country earlier today. And then we set up a plan of action, and patients typically repeat blood work 4 to 6 months later after their initial one. So if you're ever interested in working with us and don't already, go to my website, drtwyman.com. There's an application up in the top right corner. I'm not being, shy about it, but my practice is filling up. I don't know when I will be able to say that I'm still taking patients. There's a podcast that's dropping this week, most likely. It's a podcast I did with Drew Purohit. I did one with him about a year ago. That's one where I went through his Clearly scan and his Boston Heart Lab panel. It was kind of show and tell, like how I would walk through any patient's imaging and testing. So often we use that as kind of the demo podcast or YouTube video for patients to watch, or prospective patients to watch, to understand what they're getting if they come to work with us at Apollo Cardiology to get to the root causes of their cardiovascular concerns. So this podcast with Drew was a doozy. It was about a 2-hour-long podcast. We also did some filming of all the vascular testing we do in the office. I think that's going to get broken out into a second podcast. But the podcast should drop sometime this week. So once I start seeing some of the information that's dropped, I'll share it in the stories here. And if you're on my email list, I know I've been delinquent in getting the email list out, but we're going to be relaunching that email list pretty soon. So all the podcasts I've been on recently, I'll have links to them there as well. But for the time being, I will continue to always do these AMAs every Monday night, 6 p.m. Central Time. And even if my practice ends up closing to live patients, I'll keep doing these ones for those patients so that they can go to their local doctors and request the testing that they need to make sure that they can remain heart attack proof. So appreciate your guys' time and attention, and we'll see you next week.